All right, perfect. All right, thank you so much for joining me tonight. My name is Karolina Molecka. I am a laser specialist and a licensed esthetician here at Fulcrum Aesthetics. I've been in the aesthetics industry for 6 years now, and I've been with Fulcrum. I'm going to be celebrating my 3-year work anniversary this month, which I'm so excited about. But today I will be talking about preventative skin health, and then our 1927 BBL MOXI that we offer here. All right, so my objective and what I'm going to be covering today is treating pigmentation, preventing aging, sun damage repair, maintenance plans, and skincare. Alrighty, so BBL stands for broadband light. It is an advanced light-based technology that improves your skin tone and clarity. It's going to deliver pulses of light energy that target pigmentation, redness, signs of aging, and it also stimulates collagen production and encourages cell regeneration. It is highly customizable, so it treats a wide range of skin conditions, such as sun damage, redness, rosacea, vessels, pigment, and acne. So lasers work by targeting something called chromophores, and these are pigment molecules in the skin, just like melanin, that absorbs the light energy, and then that energy breaks up pigment over time, and your body naturally clears it away. And MOXI. So MOXI is a gentle, non-ablative laser. It's designed to refresh and revitalize the skin. It's going to target early signs of aging, early signs of sun damage, and it does use fractionated laser energy. It also stimulates collagen. It helps with skin tone, texture, and overall radiance, so you get a really beautiful glow. There is minimal downtime, about 48 hours of redness, and you do see dryness for about up to a week after. It is really great at treating melasma, hyperpigmentation, uneven skin texture, and just it's really great for an overall reset. So, how and why do we combine these two treatments? So, these treatments can be performed separately, but combining them, you get a really beautiful powerhouse of a treatment. So, you get layered results. BBL targets pigment, redness, sun damage, and then MOXI works deeper and addresses multiple concerns all at once. It combining them together, you get a stronger collagen and pigment response. It helps with elastin, and then it continues to give you better, longer lasting results. It is pretty much the same downtime. BBL has minimal downtime. MOXI is a little bit more, but if you combine them together, it's just one full swoop of downtime. And it is truly the ultimate skin reset. It's going to target early signs of aging, and sun damage from the surface down, leaving skin clearer and smoother and overall a lot more radiant. And combining these two technologies in one treatment, we're addressing multiple concerns in just one single session. Okay, so sun damage repair, it really is going to target damage that's accumulated over the years, addressing it directly at the source. It's going to help renew your skin. So beyond targeting visible damage, BBL signals skin to behave younger at a cellular level. Studies have shown that it truly does alter gene expression associated with aging, so it tells your cells to act younger. It's going to help treat pigment and old collagen. It's going to rise to the surface, and it's going to shed in the days following. So with the MOXI, you're going to have like little coffee ground texture, some rough texture on the skin after, but it's super manageable, and you're the only person that will actually notice that on your skin. It just kind of looks a little bit tan. Regular BBL and MOXI treatments don't just like fix existing damage, they help maintain results, and slow down future signs of photoaging. It's really, truly one of the best long-term investments in your skin health. And you can start it at the age of 20. So we always recommend a series of three spaced 4 weeks apart. Maintenance is always key, and it is a really great annual reset. So the reason why we do recommend 3 sessions spaced 4 weeks apart, it truly allows us to build on each treatment, targeting deeper layers of damage and continuing to compound those results, and it allows your skin to heal. The 4 week interval is intentional, and it does give your skin enough time to complete like its true renewal cycle. The results will continue improving, and we can truly compound the results after each treatment. And then once you're done with your series, most patients come back once or twice a year to maintain the results. And honestly, people are so obsessed, our patients are so obsessed with their results that they're doing it quarterly. So here's a really beautiful before and after of one of my patients. This is actually after just two BBL Moxies, and we did finish a full series, and we did do a third. This is her before. So as you can see, her pigment, her sun damage, just that's accumulated over the years. Truly, after the two treatments, it looks like she has a filter on her skin. I showed her this picture and she even stated that she feels like she looks younger, brighter, and fresher. So I was so excited and so happy for her to deliver these beautiful results. This is another one of my patients who actually has melasma. And a lot of providers are scared to treat melasma with BBL, which it can be tricky, but if you're with the right provider and they're using the correct settings, it BBL and MOXI together for melasma is really, really beautiful, as you can see here. So her skin tone in her lower face has really cleared up, and the clarity and tone is just beautiful after. Like she also looks like she has a filter on her skin. So preparing for your appointment, no sun exposure, suntan or spray tans 2 weeks prior. That's super important. Stop any retinols and actives 5 days before. No antibiotics in the last 2 weeks. And you can prep your skin. So we do recommend prepping your skin with elastic nectar, with Koji edit pads, and it's just gonna get rid of all of that gunk that's sitting on top. So your treatment will be that much better. So for your aftercare, you do receive an aftercare kit that you use for the following 5 days after your treatment. We don't want you using any of your own products unless it is like a elastic skin nectar or like a plated. That's totally fine to use immediately after. But no sun exposure for 2 weeks after, no working out or makeup for about 48 hours. Those microchannels stay open in the skin, and we just don't want any sweat getting in there, any makeup. You can add PRP to enhance your results for a better glow, and also for better results, better healing. You can also use elastin skin nectar, like I mentioned, 2 weeks before and 2 weeks after. Plated exosomes, it's almost like taking that PRP home with you, but it's not actually PRP, it's exosomes, but you can use that for the following couple of weeks, and it's really going to enhance your results. You're going to see about 48 hours of that redness, like I mentioned, and then up to a week of that sandpapery skin. And then be gentle, no picking. That sandpapery skin is called MENS, so microscopic epidermal necrotic debris, which is just old tissue, old pigment, old collagen that comes to the surface, which is exactly what we want to see. All right, and then this is me. So this is me immediately after the BBL Moxie treatment. This is 24 hours post. 48 hours post, and then this is 72 hours. So you can really see those men's coming through at that 72-hour mark. The first 48 hours are not that bad. It does feel like a little bit of a sunburn immediately after your treatment, but you can add the PRP that can help. You can add even PDGF, which is platelet-derived growth factor, just to help with that spiciness and help your healing. Right. And then you definitely want to protect your investment. So, using medical grade skincare will be super, super important. Using retinols, vitamin C, brighteners, peptides, growth factors. You don't have to use a million different things, but those four products are going to be super important to maintain your results and keep your skin looking really good. All right, perfect. So I am offering a 15% off discount for three BBL MOXI packages if you book by May 22nd. You can use Carolina Masterclass Skin Health as your code in the booking notes. You can go ahead and use this QR code or text us to schedule. Also, if you have any like further questions, you can DM me on Instagram right down here, but I am open for some questions right now, if anyone has any. Okay, this one. Oh, no questions right now. Hopefully, I answered all of your questions. Mm. So that's okay. So, a great candidate is anyone that has sun damage, any pigment, even melasma, someone that wants a skin refresh. But Fitzpatrick types 1 through 3, even 4, we can treat. Um, the BBL as a standalone is safe for Fitzpatrick types 1 through 3, sometimes 4. Not, unfortunately, not for 5 or 6. The Moxie is. Um, the Moxie is safe for all skin types. Okay. I have a question here. Can I do Moxie by itself? Yes, you can absolutely do Moxie just by itself, and that is safe for all Fitzpatrick types 1 through 6. And you can also do BBL on its own too, and it's good for ages 20 plus, age range 20 to 80, 90, everyone. All right. So no more questions. Thank you guys so much for joining me tonight. I hope I answered everything for you. And like I mentioned, if you have any other questions, you can DM me. And then tune in next week to see Emily Jones, and she's going to talk all about the CO2 laser, cool peel, and skin resurfacing. All right, guys, have a great night. Bye.